probably play as part of the association when you're interacting with different community groups, different family members. You may have patient base. I'm not entirely sure. I just sort of preface this presentation to say, keep all of those different hats on as you listen through this, but also keep in mind that this tool that I'm about to show you is something that you too can use. So this is for you, your family, your own dependents, as well as those that you work with in the community. We'll take the questions at the end, but please do start submitting if you think of anything along the way. So I'm just going to share my screen with you and pull up a few slides just to get us started here. So for those that may be completely unfamiliar, I'm going to start right at the beginning and sort of explain what Togetherall is, what we offer, and how our end users in Alberta benefit from some of the resources that are on offer. So as Melissa mentioned, my name is Victoria Senyard. I'm the Partnerships Manager for North America. And part of my role is doing things exactly like this, connecting with various community groups, different stakeholders in sort of the broader community that are then able to understand this tool a little bit better, and then walk you through sort of that end user experience so that you feel ready and empowered to be able to share that information with others. Right at the beginning, what is Togetherall? We offer a moderated online peer-to-peer mental health community that empowers individuals to anonymously seek and provide support 24/7. So I'll unpack that over the course of the next few slides, but you can see there right from the beginning a few key pieces that jump out. It is a peer-to-peer mental health community, and it's an online platform that is moderated by a clinical team, which I'll go through. Individuals that use this platform are able to interact with peers anonymously. And so that's really helping to foster that two-way experience. So both providing support and seeking support from others. And so there's, great evidence to kind of show that that peer-to-peer model is really something that helps many different people that are looking for this kind of support right now. Great news is that Togetherall is a government-funded initiative in partnership with Alberta Health Services. And so that means that anyone in Alberta over the age of 16 is actually already eligible and able to access the Togetherall suite of resources completely for free. So the contract is with the Alberta government, and the funding is through the Alberta government. So end users aren't paying anything at all to access our tools. Really easy to register with Togetherall, and I'll go through this process as well. But basically, it's through our mobile responsive website, togetherall.com. And the initial validation piece is just by entering a valid Alberta postal code, and that'll kickstart that process. I'll show you what that looks like. But again, sort of as we think about anyone over the age of 16, sometimes that's hard to conceptualize. But we're talking, higher education, frontline educators, as well as students and parents. We're talking frontline healthcare. We're talking seniors. We're talking all of these different demographics and different sort of sectors looking for additional mental health support right now. A little bit about what the platform actually offers that end user. So again, we're offering a safe online community where individuals remain anonymous to each other. And this is where they're able to really draw strength and insights from others with similar lived experiences. So it's that peer connection and lived experience all through an online platform where they're able to do so anonymously. That's what we're sort of offering the broader community. The platform is accessible and active 24/7. No formal healthcare referral needed by any means, but obviously working with trusted advisors within the community, able to include this resource in their suite of offerings to patient basis, and including it in that care pathway. So no formal referral, but we would appreciate anyone that's working one-on-one with patients and community groups to help promote the Togetherall as an option for different people. As I mentioned, Togetherall is moderated by registered mental health practitioners who we call our wall guides, and they're really there to ensure that individuals are kept safe and feel supported in this online environment. In addition to sort of that community forum piece and that peer community, we also have a hub of other additional mental health and wellbeing related resources. So things like clinically validated mini self-assessments, recommended courses, and just other creative tools that members can use to help track and express how they're feeling and that mental health journey. key piece to keep in mind is that Togetherall, we're not providing one-on-one counseling or therapy of any kind. Our wall guides there are really keeping that community safe in that online environment. They're not providing one-on-one counseling, and nor are we intended to be a crisis service. So while those wall guides do play a role in helping to identify anyone that may be in risk and helping to escalate to appropriate community resources, we're not positioning ourselves as a crisis line or a crisis tool per se. A little bit about sort of the why the digital peer-to-peer space. So we know that there's plenty of research out there that shows that that peer-to-peer connection is really beneficial for both those that are seeking support, but also those that are offering support. So again, it's that lived experience, and there's something there about being able to see your own experience reflected back to you through the experiences of others that you can relate to. That piece is really helping that perspective, that resiliency, and that self-coping. We also know that many individuals are already using social media sites and turning online to connect with others and to share. The difference here is that something like Facebook or Reddit or some of these other online social media sites, while great for fostering that community connection, there's no safety net. So there's not that clinical eyes-on moderation piece that's really there to keep that community safe, the escalation piece, and also the making sure that the tools are being used appropriately, and what's being shared is appropriate. So that's what they get through this Togetherall platform. They still get that online community feel, but with that clinical moderation to keep the community safe. Also, there's this increased need for safe, scalable, and accessible mental health support. I mean, now more than ever, with the impacts of COVID and a lot of people looking for additional help to kind of get through some of these challenges. This is why Togetherall is partnering with AHS and other large provincial-based government contracts and other large sort of sector-based, population-based contracts. Is that we can roll this out at scale in an affordable way to reach the most amount of people and help the most amount of people in a short amount of time. So to date, we actually have over 5,000 Albertans already registered with Togetherall, and that's from as of October onwards of last year. So every month we're getting more and more Albertans registered. And this kind of platform is actually great in that the more people we have join our global community, the better the service becomes, because you have more people contributing their experiences, their thoughts, their perspectives. So the product actually becomes more vibrant, as opposed to maybe some other resources where the bigger it gets, the resources get stretched thin. We're the opposite. We only actually get better when more people join. And so as well, where Togetherall fits in is really that idea of being able to empower Albertans to support others that are in a similar position, and then all within this clinically moderated platform. So you can see a couple of quotes on the side there, and I think these do really help illustrate the beauty of this peer-to-peer online model. The first one there is saying, the members on here are amazing. I've realized I'm not alone, and actually helping others in my position makes me feel like I have something to give. And on the bottom one, I think we can probably all relate to is that idea that, on good days, I can support others, but on bad days when I need supporting, I can find information to understand how to deal with it. And again, it's that right support at the right time for the right need. We're able to have that sort of at scale here. A little bit about our community. So it is a global community. So you'll see here in the right-hand corner, Togetherall, we actually were founded in the UK back in 2007. And so by no means are we a startup. We've sort of been a little bit old hats in sort of this virtual mental health realm, particularly in the peer-to-peer space. And since then, we've launched into America, as well as Canada, as well as New Zealand. And so because of that, with all the different contracts, employers, different groups that we work with, our community is actually made up of millions of eligible people from around those jurisdictions, all contributing to the same platform in an anonymous way. A large chunk of our member base is that sort of student and young adult age, so that 16 to 34 range. And actually students specifically, we just hit the 2 million mark. So we're actually 2 million students are covered through Togetherall across those different jurisdictions, which is pretty incredible. And then once they're in the community and they're interacting with each other and some of the other tools and resources, we know that the engagement sort of compounds. So the number of posts that are created, the number of comments, the number of tools that are accessed, you can see here sort of just up and up and up the more people sort of register. In terms of who this support is best suited to, as you look at this sort of graph here, it's really this population-based approach to mental health. So we're really aiming more at those that have no current mental illness, but perhaps a need for additional resources or direction. So sort of the general public sort of piece, all the way through to those that might have a mild to moderate mental illness, but still a low level of need of escalation or intervention. So again, it's sort of that broader group that particularly right now have, are feeling overwhelmed, have that, that stress, that anxiety, the juggling multiple things, the working from home. That sort of group is who is looking for additional support to get them through some of these tough times. And that's how we're seeing sort of this member base only grow. A little bit more about those wall guides. So again, these are our registered mental health practitioners. Typically, they're licensed to practice they are licensed to practice in the jurisdictions in which they're based, and they are typically clinical counselors or social workers, sort of from that sector. And they're there providing that 24/7 moderation and monitoring the platform, and also able to identify those that may require additional help and either signpost additional resources within our community, within our platform, or if needed, escalate to other community-based resources and at that far end, also sort of that EMS piece. So they have three primary roles. The first is that safety piece, ensuring all of our members adhere to what we call our house rules. And all of this is sort of put in front of a member when they first join and explained. The anonymity piece is for their own protection and to ensure their safety in this online environment, as well as sort of what the point of the tool is and to be a really safe, open, supportive place for mental health concerns. All of that is sort of put in front of a member, and so also sort of enforced by our wall guides. So again, unlike something like Reddit or Facebook, where you might get people that are deliberately derogatory or offensive or sort of trolling a site, that couldn't happen in Togetherall because we have this moderation and because we would be able to sort of curate that content and at the far end actually be able to block people if they were sort of breaking those house rules. And again, it doesn't happen very often because it's positioned as a mental health peer-to-peer community. Other peers are also picking up on it and sort of moderating as well. And then that escalation piece, obviously, we're working with Alberta Health Services to help connect anyone that may be in need of more specialised support to provincial-wide offerings. So things like 211, the 811 HealthLink line, mental health and addiction support, those sort of provincially available resources are also being signposted by our wall guides to Alberta member base if there's sort of a situation, maybe more specialised support is needed. 9 times out of 10, the broader piece of what our wall guides are doing is just ensuring that vibrancy, making sure the place, sort of the platform remains supportive and engaging, responding to new users, keeping the conversations flowing, and promoting that resiliency and self-care through fostering sort of discussions around common mental health concerns. That navigation piece as well is sort of helping members navigate the tools within our platform. So pointing out things that they may not have noticed or are responding to questions and requests for guidance of how to find these tools. They're also able to do that. The beauty of having this as an online environment as well is that we're able to leverage the technology behind the systems as well. So we have inbuilt algorithms that actually help flag a lot of this different user behavior directly to a wall guide, and then our wall guides are able to sort of then action those different pieces. So for example, not only does these algorithms pick up on risk words, trigger phrases, things where there might be indications of potential risk, all of that would be flagged to a wall guide to review in the context of sort of the broader behavior and see whether they need to intervene. On the other end, it's also flagging things like, this is a new member, this is the first time that they're contributing to the discussion. So they're also looking to make sure that those responses don't go sort of unattended. And if a peer hasn't actually chimed in, a wall guide would also be able to, and to really make sure that every member feels heard and seen. That's also part of sort of what's triggered to them. So there's all sorts of different things that the technology helps signpost to our wall guides that then enables them to do, that coverage, that 24/7 coverage, and also enact different sort of pieces behind the scenes. So I'm going to switch over to the platform itself, and then hopefully this will all make sense when you can see it actually play out. I will note that as part of the marketing materials that you'll receive after this call, you will get a bit of a quick 2-minute explainer video and also a member testimonial that you can also have a look at, that hopefully captures some of the detail that I'm going to go into. But also remember, you too can register again yourself. So either during the presentation or after the presentation, you can create an account really quickly. And you can then go into and have a bit of a look around and use the tool yourself as well. So I'm just going to cross over to the platform itself. Whoops, I just made that video start playing. My apologies. Okay, so you should be able to see my screen now. Please do let me know if you can't. So this is our website, togetherall.com. This is where you would come just to learn, more about our tools and our company as a whole. You can also see some commentary or sort of what we're doing in different sectors in the work we're doing. This is where someone would come for the first time. You can see here we're in the login registration page. They would just need to hit register for the first time. And you can see here it's going to prompt them to put in their postal code. Once they do that, then they'll be asked a few more questions, and they'll also be asked to provide their email address, preferred email address. And then it's a 2-step verification where the link to continue their registration will be emailed to them. They would click on that, and then they can finish off creating their account. When they first create their account too, part of what they do is create an anonymous username. So that helps protect their anonymity in the platform to other peers. But our wall guides would also be able to see, so for in this case, Alberta, it would sort of be whatever the username is, and it might be -Alberta. So in the back end, the wall guides can help see that information a little bit more. And they're also able to work with their senior clinicians if ever they need to unlock more of that registration data in the event of a risk escalation. But majority of the time, it's really just being able to know, okay, this new member is from Alberta. If needed, these are some of the other Albertan related resources that they might signpost. So once someone creates an account, they would go back, they're going to hit that registration button. And I've already got an account, so I've skipped that step and just jumped straight in. I'm just going to make this a little bigger for you. So this is the dashboard. So you can see here, so this is my anonymous username. I guess not so anonymous when I keep using this for demonstrations, but this is me, that's fine. You can see here the platform straight away is deliberately quite simple and intuitive to navigate. That's because we know we're servicing lots of different people from different backgrounds, different tech levels. The site itself and all of our tools have gone through a very thorough accessibility checks and compliance piece as well, which we also have links to if you're interested in kind of seeing any of that. But we are compliant with those standards as well. So once I land here, there are a few things I want to point out to you. So you can see right from the beginning down here, there's a little chat box here that I can actually chat and reach out to a wall guide. I'll also receive sort of introductory messaging when I first join. So that will a wall guide would reach out to me directly, sort of explain their role, help point out some of the functions of the site, and just sort of remind me that they're there if they have any questions. So I'll get that when I first join, as well as sort of as part of that registration process. It's all laid out to me. But if I wanted to proactively reach out to a wall guide with a question, I can always just click on here, and it's a direct message to a wall guide. And it's not an automated sort of chat box. It's not AI. It's a real wall guide. It's a real person. So that's sort of I can reach out to them directly. These 3 buckets I'm going to go through. So these are the 3 sort of resources that members are accessing. This community portion, this is sort of the key piece here, and this is where members are anonymously interacting with others. So you can see here, this is a live site. This isn't a demo site or anything. This is the platform. And you can see, people have posted something 15 minutes ago, 16 minutes ago, all sorts of different topics. Now, each of these represents sort of a different conversation and a different thread that's happening. So you can see here lots of different things. A couple of ways to filter this content to find what you're most interested in is by the category. So I can tick on different things that might be, relevant to me. I'm just picking anything here. and you'll see that these tags come up. Now, anyone that's created a comment that has used these, they have to pick their tags as well. It can say, okay, well, this thread has something to do with one of the tags that you're interested in. So that's one way to filter the content. The other way to filter these threads is by the type of post. So you can see here we're in the view all section. A talk about is a written thread or a written conversation, and a brick is a visual concept. So someone has visually expressed how they're feeling, and that's sort of a different way to express themselves. So I'll show you, someone's just posted 28 seconds ago, this is constantly coming in because again, we have that global member base with that global experience looking to connect around sort of common mental health concerns. So if I wanted to contribute to this forum, what I can do here is create a talk about it or brick. And I'll show you how easy it is. So this is me saying, feeling stressed. I could then tag what I think it most relates to. I might even say sort of general, loneliness, happiness, whatever the case might be. And you can see those tags come up. And then I have the 3,000 characters to describe what's going on for me. Now, again, if I started to say, I'm Victoria Senyard, I'm based in Vancouver, this is my street address, that would be flagged to a war guide. A war guide would be able to actually remove that level of detail while at the same time reaching out to me to say, hey, remember, as per the house rules, we don't use personally identifiable information for your own safety. We've got to remove that, but the rest of your post is fine. So they're able to do that sort of moderation and curation to keep it safe. Similarly, if I started to use trigger words that we have sort of a very robust back-end system that's picking up on things like, some of the obvious ones would be suicide, self-harm, death, things like that. But also things where in the context, we've actually found different things over the years can also be worth sort of having a look at. So even just the word life, depending on the context, could actually be a trigger word, for example. So that would also be flagged to a war guide. If I had any of that, they would be able to see my content, kind of review it, and if need be, reach out to me and sort of check in and either signpost additional resources or explore maybe the risk scenario and does it need to be escalated. 9 times out of 10, it's really just me sort of saying what's going on for me right now and my experiences with this particular topic. And then I would post that and it would become the first thread in that community forum. So I won't do that because we are live, but I'll just jump and show you the other two buckets here. Group talk about, very similar to the first option there, but in this case, as I start using the platform more and I start recognizing different usernames, or perhaps I connect with particular users on a very specific topic, I might want to invite them to sort of a more private conversation about something and really drill into it a little bit more. All of this is still seen by the wall guides and moderated. It's just a little bit more private than that sort of public view. And then the last one here is a brick. And this is a really interesting one. So again, you can title this whatever you'd like. You can either freehand draw sort of something. And this is a terrible example, obviously, but some people, spend a lot of time and really get into this. The other thing that you can do is upload imagery. Again, couldn't be anything sort of personally identifiable, but it could be stock imagery. It could be, something that you find calming that you've used as a tool in sort of anxiety reduction. It could be, a photo of your last holiday that you're reflecting on now that you can't travel. It could be anything. And then also words as well. So I often see people that have, created their own poems, so they include poetry, or it could be quotes or mantras that they sort of live by, all sorts of different creative ways. And it's really for those that maybe struggle to articulate how they're feeling, but more gravitate towards expressing it. Or those that are just sort of more naturally a little bit creative, and this appeals to them and is engaging to them. Similarly, you would pick sort of what your image most relates to, and then you have the option of adding additional commentary. Don't have to, some people don't, but sometimes it's sort of to explain what this picture means to you. It's just another way to express. So then if we go back to the platform now, so again, in this view, we've got both of those written comments as well as those visual comments. As you find things that you're interested in, you can star them to follow along, and I'll show you some examples where I've starred them. And you can play around with your account settings in the top here to say, anything that I'm following, let me know within the platform if there's been new activity, a new comment on that thread, or email me with a notification. You can kind of play around with how you're notified. The other thing you can do is, as a regular member, I too play eyes on, as I'm going through this. If I come across something, I can also flag it to a wall guide to triple check that they've seen it. Of course, they usually have, but it also gives me peace of mind that, I've played a role in helping keep the community safe. So for example, if I come across something that I personally find offensive, I'm worried about someone based on the language they're using, or maybe there's something else I wanted to flag, I could tick one of these, and also that would sort of then go to a wall guide. That's the end of my involvement, but I just have sort of extra eyes on all of this content, which is nice. So as I sort of, as you go through this and you find things, these are some start examples that I've kind of collected over the time. So I'm going to pull up a couple that I think are really quite general, but also kind of show the beauty of this site. So this one was a little bit older. This is 17 days ago. So as you see, a lot of these come in quite regularly. So 17 days is actually an old one. But you can see here, this is quite general. So this one's saying, oops, I'll just scroll to the top here. We are like roommates raising children, so lonely. This is from Ocean 27, so we don't know, where they're based. There's been 37 comments on this topic. It was last created last month, and the tag that they've used here is sort of relationship. So it's relationship-based kind of issues. And they've said, they reflect here that their marriage isn't great. They feel like they're roommates raising children. It's just really hard, and particularly during lockdown, I'm assuming this is what's going on for this particular person. You see here, this is part of what the wall guide's role is, to always respond to, if they're not the first response, they're typically one of the first, to sort of just reflect some of that sentiment, thank them for sharing, make them feel heard. You'll notice they're not providing counseling or direction of any kind. It's really just helping to kind of kickstart the conversation and make sure other people are chiming in to help. They kind of say, we're here if you need me. And then you can see all sorts of, other anonymous people are chiming in as well, asking questions, providing their own feedback. I'm in the same boat. Here's their situation. The original poster is kind of interacting with this as well. And you can see here lots of different comments, sort of, sharing experiences, which is really nice to see. So that's sort of a relationship-based example. As I mentioned, we get a lot of students. So this is clearly a student-related issue. So they're sort of saying COVID and university is the topic here. Depression and loneliness. Universities left me with no friends. Their housing situation sort of up in the air. Then COVID has sort of ruined their year. You can probably hear a lot of that sentiment as well in the groups that you work with. Interesting that their sentiment here is actually, just venting. If anyone else feels the same, you are not alone. So already they're flipping it to say, yes, I feel awful, but if you feel awful, we're in this together, and we can figure it out. And you often see a lot of that similar sentiment, like regardless of the topic itself. It's that idea of, I don't know who else to talk to. I feel alone. Does anyone else feel like this, or is it just me? I'm sorry, this is a vent, but I need to get it off my chest. There's a lot of that kind of sentiment all the way through, you'll see. Again, the wall guide sort of chimes in to reflect some of that sentiment and thank them for sharing. And then again, you get all sorts of people from all around the world that are saying, I can relate. I'm in my 4th year. This one's saying I'm in my 2nd year and this is my experience. Kind of lots of different feedback. This one's a bit shorter. You can see here. So it can be as long or as short as sort of that thread sort of entails. One last one I wanted to show you here, just to sort of show you the spread of this, is that it's not just sort of the young tech savvy people. This one I thought was heartwarming. Again, a little bit older. That one's 29 days ago. But this one's saying need to connect with seniors in a similar situation. So they're saying anxiety, depression, general chat. They're a senior living away from their family. The pandemic's hit them. They're not seeing their grandkids. They feel isolated. They're afraid for their health. Looks like the person they're living with is sort of downplaying the pandemic. There's some depression and attempted previous suicide in the last 12 months. All sorts of different things there. And again, you have other people then chiming in to provide their sort of feedback and how they've dealt with something similar. So it's just really interesting to see that other seniors are using this and finding each other. And how people title their piece also helps people find those same topics. So we saw seniors, we saw uni. There was another one here that was I thought interesting from the flip side of, a university lecturer is feeling overwhelmed. And we see that again with sort of other frontline workers. So it really helps people find each other. An example of that brick. So this is just a quick one. So this is someone saying feeling small, they've tiled it anxiety. And you can see here they've used that tool to really sort of express a lot of different topics, but in quite a simple, compact way. And again, have sort of people commenting and thanking them for expressing themselves. So that's the community forum piece. I'm just going to go back to the dashboard. So that's that community piece. The other two buckets here are our wellbeing and mental health resources. So here, these are self-help courses, self-paced courses as well. So lots of different topics here that have been created. And these are things that people can start, finish whenever they'd like. For example, you kind of work through different modules. Each module will have different things within it, whether it's sort of like mini homework type activities, links for other research, little self journaling, goal setting activities, all sorts of different things. And then the great thing is that each of these courses have what's called a course talk about associated. So that means that anyone that's doing this course can decide to join that group, and then they're chatting with other people that have done the course or are going through the course at the same time, and sort of compare notes, compare sort of sentiments, all that sort of thing around this topic. Again, all of that is seen and curated and moderated by a wall guide, but it just helps, again, people find each other and connect around different topics and sort of share that experience. So that's the courses piece, and you can do multiple of these at a time. You don't have to. You can see I sort of started one but haven't finished it yet. No pressure around finishing those. But you probably would get reminders of, hey, remember you've still got that piece if you want to come back to it. And then in our resource section, there's those same little self-help tools, so an online journaling activity, a goal setting activity. These are our mini self-assessments. So you can see here quite a few here. And again, these are based on clinically validated self-assessments, so PHQ-9 and GAD-7 and things like that. They're not meant to be diagnostic by any means, but really just a self-check and to kind of see where I might fit in. And it can also be embedded in some of those courses as a way to check in and to track how I'm feeling and sort of quantify it a little bit more. So again, you can kind of see here, this one's based on the GAD-7, the anxiety. And so you would go through quickly. You could kind of, I'm doing this very quickly, but tick these off. And then it will give you a bit of a scale. Now, the recommendation is tailored based on sort of, where I'm scoring. If I was consistently scoring highly, that would also be flagged to a wall guide to check in and maybe point out some other resources that I might find helpful. But you can see here, I've done this a few times, but it means I could do this as often as I want and kind of track it over time too. And that's sort of similar for those other pieces. And then the last piece in this resource section is our sort of articles and sort of hub here. And now it's not just articles, it's book reviews, it's interviews with those that have sort of gone through different experiences, still all categorized by those same categories. So I could really drill down into the different topics I'm interested in. And the other great thing about this section is that it's organized under these three categories. So understanding more, moving forward, and learning skills. So again, it sort of recognizes that everyone's in a different place, a different journey. Some might be right at the beginning, just looking for awareness, or maybe looking to find information to help someone else, or they're right in the thick of it and they're looking for some really practical tips and advice to how to move through something. So it kind of organizes it by that category too. This is where also stepping back as Togetherall, we're constantly improving the member experience. And something we're looking at here is adding, we call these sort of our tiles. There's going to be some tiles here that are more provincially based, Alberta specific resources that we're also going to put in front of members. So again, it might be that, 211, 811 kind of tile. So as I'm finding resources, I could also find some like Alberta based pieces within this as well. So really trying to help people be able to navigate and find the things that are available to them. So that was that resources section. Down the bottom here is those house rules, the privacy terms, a way to give us feedback if there's any issues with the tech, all of that good stuff there. Also up here is my sort of account information if I want to change anything or search for anything. And that's it. So what I'm going to do is switch back over to the platform itself. Great. And so really, before we wrap up, the bringing this all back together, that the ask here is really just to help us spread the word. As I mentioned, you too have access, so I'd love to see you, register yourself and go in and have a look. I personally register as well, and I go in every few days just to see the different discussions that are happening, keep my pulse, finger on the pulse a little bit about what's going on. It typically reflects what's going on in the broader kind of community with COVID, for example. There's a lot of COVID-related conversations, but it's really interesting to kind of see the sentiment play out. And then what they ask here is, we work obviously very closely with Alberta Health Services on our marketing and outreach, but also great community informal partners like CMHA, working with Healthy Campus Alberta, all sorts of different groups to make sure that we can give them what they need to then be able to take this message to those that they support and they work with in the community. So really trying to gain support for Togetherall, broadly. Also aiming for to extend our reach, not just the sort of the urban areas, but also the rural communities, which we know we're struggling, particularly with some of that isolation piece right now. Really educate and build that awareness of what Togetherall offers, and create champions, and empower you guys to have what you need to spread the word, and ultimately encourage action. So whether that's sharing it with someone else, registering, or sharing it with someone that that they're able to get the help that they need. So with that, I'm going to hand it back and see whether we have any questions, feedback. Feel free to submit through the chat or to turn your audio back on. But would love to hear, do you love it? Do you hate it? Can you see this being used by the groups that you work with? Where else do we need to promote? Anything and everything. Would love to pick your brain.
Hi, Victoria.
Yeah.
My name's
Hi.
Lexi. I just wanted to say thank you for your presentation. It was really, really informative. I think this is such a helpful tool for a lot of people that I know in my life. Like, I'm a university student as well, and with the people that I work with. So I just wanted to say I thought it was an awesome presentation, and thank you.
Oh, perfect. Thank you. No, and appreciate it. The beauty of my job is being able to connect with people from all sorts of different sectors and backgrounds and everything. And so no, appreciate your time listening in.
Yeah, thank you.
Thanks. So I do see a couple of questions. I'm just going to read through them. I'll start back at the beginning. Looks like first question is, will we be providing slides? Yes, we'll also have the recording that will circulate around. Is Togetherall available in other provinces? Great question. So yes and no. So right now, the Togetherall service is embedded as part of the broader Wellness Together suite, the federal offering. The difference there is that it does involve an intake kind of screening or assessment piece that helps then, we're one of, I think, 9 different resources embedded within that offering. So there's no way through that channel for someone to sort of pick Togetherall to access. It's kind of, it routes people. So technically anyone can access Wellness Together, but that's also a COVID-related response. So when it's not necessarily a long-term offering, it really is sort of a piece for the short term. So right now on a provincial-wide scale, it's only Alberta, and of course we're hoping to sort of expand on that. We have been in Ontario for the last few years as well. We're also pivoting that to really be able to really properly support the higher education sector in Ontario. So we're figuring that piece out right now. But we do support states in the US as well, and different higher education institutions in the US. So lots of different interesting work going on. Another question. I'm curious how long Alberta has committed to funding this platform. So typically I steer away from any funding questions. This should go to Alberta Health Services, but technically right now it's a 1-year contract. I think this is a great resource. Wondering how the personal data is used or not. How is it kept secure? So all of the personally identifying personally identifiable information. So part of that registration information, for example, is all stored within Canada. And you can imagine, being a government funded initiative, the privacy impact assessments, all of the governance that went on to bringing this on into Alberta, it's gone through all of the checks and measures. And so all of that data protection piece is something that we're very, very conscious of and have to adhere to as part of a government contract. So that piece is all safe. The only time that our clinicians are able to sort of unlock that information is in the instance where we need to help connect a specific member to emergency services in sort of those risk scenarios. And in that case, our senior clinicians are able to access a little bit more information. So it'll be things like that email address and the Alberta postal code. Those things help us then narrow down where that person might be based and then help connect them with local emergency services. But it's only in the case of risk. It's not in sort of that general piece. And so Alberta Health also doesn't see that data or anything like that. Question was around the age range. So it's anyone 16 years or older. And so again, it's not a youth-based program, so under 16. So we're not talking sort of higher ed, apart from that sort of higher grade 12, for example, but post-secondary onwards. So unfortunately, not high school students. And yes, it is a free offering to anyone in Alberta. There is not an app for this, but it is a mobile responsive website. So everything is being configured such that if you used your mobile to log in, or you used a tablet, for example, it will all configure. And again, that's sort of part of that accessibility piece that has been fully checked as well. So maybe later we might have an app, but not right now. Are we allowed to advertise this program freely? Yes, absolutely. A Facebook newsletter, yes. So we, if it's of any help to you, we have, graphics, mini videos. We have some social media templates that we can give you to make your life a little bit easier, so that it's, easier to plug and play. But absolutely, particularly once you register and play around and kind of really familiarize yourself with the tools, the more the merrier in terms of promotion via social or your other communication channels. And if you do need anything, you're more than welcome to reach out to me directly, or you can reach out through that Togetherall webpage. There's a contact us at the button, at the bottom of the webpage. And so you can click on that and request, additional promo, or you can bring this demo back to your own specific teams. If you have a team not represented here, always more than happy to do a similar run through with different groups. So anyone offering peer support through this platform is doing it as a volunteer. So it's peers helping peers. So it's general members helping general members. So right now, it's not sort of trained peers. Our war guides offer that clinical trained element, and then it's as if all of us here had joined anonymously and are sharing our experiences and sharing that perspective on how we worked through our own similar challenges. So the peer-to-peer is sort of regular member to regular member kind of concept. Do you share stats with agencies about regional access numbers? No, not specifically. The ways that we break down the data at an aggregate level are more sort of demographic based. So, age, ethnicity. We have different things as part of the registration process. It will ask, are you a student? Are you unemployed right now? Are you full-time employed? It'll break it down by sort of those pieces to get a better sense of what's our member piece, and that's how we break it down. Right now, we're not breaking it down by geography, and we're not able to identify sort of, this number of people came from, a particular area. Someone just emailed it to their integrated networks. Thank you. Perfect. That's what we want. The helping to connect the dots is the hardest part of my job. Of, you're on the front line, you're on the ground there. You know which other groups should know about this, or who should hear about this, who would use this. My job is to help facilitate that and give you what you need to help pass it along. So as part of the marketing bundle you'll receive, it'll be sort of an interactive program flyer that has the links to registration, the video of explaining what it is, and some other materials that you can embed in communication channels. We'll get that all over to you. And if there's something that we're missing, feel free again to sort of go to togetherall.com and click on that contact us and just outline what it is that you might need. And typically it's me or it's one of my team responding to that request. If Alberta stops funding in a year, how does this impact people already on the platform? Do they lose access? So the registration, it won't cut people off straight away. Let me tell you that. So for example, say, end of the year, the funding's pulled. Anyone that's registered up until that point still has 6 months access under that sort of current contract. But what we're also able to do, and this is why we connect with different community groups, different higher education groups, is that at any point, an institution, for example, might say, I really like this product. I want to bring it to my campus specifically and customize it and configure it even a little bit more to my campus environment. So for example, being able to signpost some of those campus related resources as opposed to provincial related resources. You could have a campus that says, I want to keep this for my staff and my students, and we could work with them directly. So that's what we're sort of doing in different areas as well. So while obviously we would love this to continue to be a provincial wide offering, if we ever had to pivot to kind of more direct base, then it's really about who's interested in keeping it on, and we can work with those different groups. So a question is, might you or another colleague be available to do a shorter version of this webinar? Absolutely. So I will work with as much time as you give me. Thankful for the full hour today to sort of go into real depth, but often I get asked to do, a 15-minute, 30-minute snippet, and I sort of accommodate accordingly. So absolutely, again, feel free to reach out to me directly if you have a group in mind, or through that contact us page, and we can tailor something for whatever group you have in mind. Question, ever considered creating a youth/teen, so 12 to 17-year-old specific section or platform? It's the piece that it makes that hard is just what is considered a minor. And so again, because we cover UK, US, Canada, New Zealand, working with different sectors, different sort of duty of care, the minor piece is what gets it tricky, because then it's also who has that duty of care. When it's above that, we can escalate to emergency services and things like that, because they're an adult, they're providing informed consent, all of that piece. When it's lower than that, that's where it gets tricky. And so that's sort of that blanket 16-year across everyone that we work with. That being said, we do see a lot of, parents on there finding information about how to deal with XYZ child-related, developmental related issues or things like that. So there are ways to help that group indirectly, but unfortunately, that group wouldn't be able to register themselves directly. So another comment here, some of the regions are launching Health for Youth. Parklands and Edmonton launched July 1. Perfect. So, and that's the point of this too, is, as you hear of other resources, feel free to share that with your colleagues. And part of what we'll be doing is, again, configuring that resource section to have Alberta specific resources. We're also conscious of covering that broader spectrum. So if it's linking back to other provincial resources that have, the full list of here's youth related, here's other pieces, so that if they're looking for something that isn't within our platform, hopefully we're helping connect the dots and they can find that through some other channels. Okay, I think that looks like all the questions. If I missed any, I apologize. Feel free to reach out again. And as I said, we'll circulate some of this information. I know Melissa and her team are looking to do that. But yeah, thank you so much for your time, your attention, the full hour, and hopefully you learned something new.
Thank you very much, Victoria, and thank you everyone for your great questions and for joining in with us today. And like Victoria said, we'll circulate the recording along with the marketing materials and any other materials you want to provide Victoria, along with her contact information in case you want to offer a session in your community. Thanks everyone. Have a wonderful afternoon.
Thank you. Bye-bye.
Bye.